Hi everyone, welcome to today's session. Today we are going to see question and answers from oral medicine. So moving on to question number 1. The areas from which X-rays emanate is called, they've given us 4 options: target, focal spot, intensifying screen and cone. The answer to this question is focal spot. So what is this focal spot? Focal spot is the area of the anode surface, that is the radiographic target surface, which receives the beam of electrons from the cathode. It is the apparent source of X-rays. So moving on to question number 2. Trench mouth is, they've given us 4 options: Vincent infection, prevalent in age group 15 to 35 years, endogenous oral infection. The answer is all of the above. So the other name of trench mouth is acute necrotizing ulcerative gingivitis. So moving on to question number 3. Erythema multiforme is, they've given us 4 options: immune mediated disease, self-limiting, induced by sulfa drugs, and all of the above. The answer is all of the above. So if you see about erythema multiforme, the erythema multiforme is a dermatological disease, and it is a reactive mucocutaneous disorder in a disease spectrum that comprises a self-limited, mild, exanthematic, cutaneous variant with minimal oral involvement in case of a minor erythema multiforme, whereas to a progressive, fulminating, severe variant with extensive mucocutaneous epithelial necrosis in case of erythema multiforme major. So moving on to question number 4. Unit for measuring absorption of X-rays is, they've given us 4 options, and the answer is RAD, that is the rad. So what is rad? Rad is nothing but the radiation absorbed dose. That is called as rad. So moving on to question number 5. Which of the following is considered radio resistant? They've given us 4 options: immature reproductive cells, young bone cells, mature bone cells, and epithelial cells. The answer to this question is mature bone cells. So moving on to question number 6. What is the required distance for an operator to stand away from the patient when taking X-ray? They've given 4 options: 2 feet, 4 feet, 6 feet, and 8 feet. The answer is 6 feet. This is a important clinical side viva also. So moving on to question number 7. Kilovoltage controls the speed of, they've given 4 options: photons, electrons, anodes, cathodes. So the answer to this question is electrons. So moving on to question number 8. The radiation generated at the anode of the X-ray tube is called, they've given 4 options: primary radiation, scattered radiation, potential radiation, reverse radiation. The answer to this question is primary radiation. So moving on to question number 9. The removal of parts of X-ray spectrum using absorbing material in X-ray beam is called, the given 4 options: elimination, filtration, collimation, and reduction. The answer is filtration. Moving on to question number 10. The period between radiation exposure and the onset of symptoms is called, they've given 4 options: latent period, period of cell injury, recovery period, none of the above. The answer is latent period.